Welcome back to the channel, guys. My name is Edward. If you're new to the channel, I'm a 21-year-old dental student studying at the University of Adelaide. So if you're considering to study a health-related degree, this is a question you're probably going to come across, and that's choosing between dentistry and medicine. So today I have the help of one of my best friends, Daniel. Do you want to introduce yourself?
Yes, so my name's Daniel. I'm a fourth year medical student at the University of New South Wales. And I've known Edwin since high school, so that's like almost 10 years that we've known each other.
Yeah, so in today's video, Daniel's going to help us answer the medical component of things on how he sees the medical degree, the medical profession, and what it involves comparing to dentistry. So before we begin into the pros and cons of each degree, we're going to talk about a brief overview of each course. So dentistry and medicine varies depending on where you are in the world. So in Australia, we have two options. That is the undergraduate pathway, which means you can get in straight out of high school, or the postgraduate pathway, which means that you have to first acquire a bachelor's degree before applying. So in either case, most people who get the marks required will choose the undergraduate pathway, as it's shorter. For dentistry, it's 5 years, and for medicine,
it's 6 years at my uni, but 5 years at some other undergraduate unis.
Yeah, so the course will vary depending from university to university, but the overall things you learn and the clinical practice is roughly the same.
Yep.
So in dentistry, the 5-year degree, so in first year and second year, you'd learn about the underlying biological processes of the human body. You learn about how the teeth develop, how to classify teeth, how to fix teeth for caries. And in senior years, you learn more about the complex diseases like with oral pathology, oral cancers, periodontal diseases, and more complicated diseases. But throughout the years, you get clinical practice. In dentistry, first year, first week, we got to go hands-on into a real clinic and learn the things about infection control, about how to use instruments. And so by the end of year one, we were comfortable giving a very basic examination. And that goes all the way till year 5, which is like the intern year for medicine. 5th year, we have no new content. It's just practice for the whole year. The university allocates placements for students at different locations. And you undergo about 2-3 days of practice per week. And after graduation, you're free to work in public or private setting, depending where you choose to. So, yeah.
Yeah. In medicine, I can't really talk about other unis, but for my uni at the University of New South Wales, it's a 6-year degree. So in your first 2 years, it's kind of like what you'd imagine traditional uni to be like. So you go to lectures and tutorials and you learn about the science of the human body. As an added bonus, once a fortnight, you get to go into hospital and interact with patients and practice history taking and examination skills. In your 3rd year, you get to go into hospital 3 days a week. You get to shadow doctors, go into theatre, and also practice your history taking. And there's 2 days a week at uni. In your 4th year, it's a research year. So you spend the entire year working on a project and you pretty much work with a doctor who helps supervise your project, and you get to push the boundaries of what we currently know about science. And your 5th and 6th years are clinical years. So you spend 5 days a week in hospital. And yeah.
So you're currently in your 4th year, so you're doing a research project. Do you want to share with everyone what you're researching right now?
Oh, sure. So right now I'm looking at it's a non-inferiority study looking at operative versus non-operative management of appendicitis in children. So what that basically means is we're just looking at if we can treat appendicitis with antibiotics rather than surgery.
Surgical intervention.
Yeah.
So yeah, very interesting. So that's unique to the University of New South Wales from what I know. So some of the other medical schools don't have that.
Yeah.
So that's why it tends, their degrees might be 5 years instead of 6 years. So do you enjoy the research?
I do, yeah, it's good. And everyone gets to pick what they want to do. So everyone has a different research project and they get to look into like what they're interested in. So it's quite a like personalized year, 4th year.
Now for dentistry, our 4th and 5th year is optional. You get optional research. So honours is actually embedded into the degree. So if you choose Queensland University or Adelaide universities and maybe some other universities around the world, they have an honours project embedded in the 4th and 5th year. So you can graduate with an honours in dentistry. So that is a brief overview about each of the degrees. So now we're going to jump into what we think are the pros and cons of each degree and help you decide which degree you should pick. All right, so I'm going to begin first, and we're going to talk about the pros of dentistry. So in my opinion, I think that dentistry is definitely more clinical based. So we learn a lot more about how to manage caries, how to examine teeth, how to use instruments, and we're jumping into a simulation clinic, which is where we work on dummies, and clinical practice where we operate on each other, like friends and colleagues in year 1 and year 2. So we get experience quite hands-on to begin with. Now, with medicine, there is still clinical practice, right?
Yes, yeah. So you get to go into hospital once a fortnight, where you do get to interact with real patients and you practice taking histories and also examining relevant systems. And every other week that you're not in hospital, you practice with friends, or they can bring in actors, and so you get to practice basically interacting with patients there.
Yeah. So what's a pro of medicine?
Well, I think one of the main ones, and one of the ones you hear a lot, is that you get to help others. So I'm a huge fan of this, but also don't really like the term helping others so much, because I think every profession is out there and exists to help others. Dentists certainly help people a lot.
Yeah.
So what I like about helping others is you get to help others with their health specifically. And so what is really cool about that is I think health is a really important aspect for a lot of people. And so I think it's quite a huge privilege actually to have people come to you with problems with their health, and you get to help them out and pretty much improve their life, which is really cool.
Yeah. I think if you choose a degree in health, whether that be dentistry, medicine, physiotherapy, you're out there to make people's bodies and health a lot better. So I think that would be one of the main reasons that most people choose to work in health. But as you said, no matter what you study, you're going to be interacting with people and helping others. So dentistry and medicine have that shared pro, I would say.
Yeah.
Okay, so the second advantage of dentistry that I'm going to talk about is a shorter degree. So, and it's a lot more focused on what you're going to practice. So with dentistry, we're going to be working within the oral environment, the oral ecosystem, and we're going to be treating diseases related to the face and mouth. So from day one, what you learn, it tends to be a lot more targeted towards that goal. We will be learning about development of teeth diseases, clinical skills on how to amend and fix those problems. But in medicine, you'll be learning a lot more overall, more broad concepts about the human body, the systems, and the diseases that can go wrong with each system. Am I right?
Yep.
And so if you like breath, then you're going to enjoy studying medicine. You're going to know the ins and outs. But for dentistry, you get to jump right in into what you're going to eventually become.
Yeah. So as Edwin said, in medicine, you do pretty much learn about every single system in the human body, which is really cool. And what that also means is, as an extra pro of that, it means when you do choose to specialize in something, there's so many options you can specialize in, and there's a lot of variety. So you can go into surgery, you could become a GP, you could go into dermatology, anesthetics, there's so many different pathways you can choose. So that's really cool. Yeah,
so the option of medicine is that the specialties are so different from one another.
Yeah.
Dentistry has its specialties. So if you go to a general dentist, they can practice a lot of things. But if you have a specific problem wrong with maybe your gums, you would go see your periodontist. If you need a specific case of braces that most general dentists can't, you go to the orthodontist. But they're all teeth related, and they do mix and match a lot more than the specialties of medicine. All right, so pro number 3 is that dentistry work tends to be a lot more flexible. Because when you graduate, you're not inclined to do 1 year of intern and residency as you have to do with medicine. So when you graduate, you get to choose the hours you want to work. For example, if I only wanted to work maybe 3 days, and for the rest of the 3 days I want to do something else, I could do that. So it's a lot more flexible in that regard. That's not to say medicine isn't flexible, because medicine, eventually when you become a specialist, you can choose your hours.
Yep.
But when you graduate, you're inclined and obliged to do a certain number of hours at a specific hospital.
So another pro of medicine is that the content you learn is really interesting. So it's about science, and specifically the science of the human body, which means I think that's really applicable to everyone, how the human body works and how our own bodies work pretty much. And you also get to learn about everything that can go wrong with the human body and how to fix that, which I think is really cool. As an extension to that, it's also very intellectually stimulating. So while it's not as like glamorous as Dr. House or like Sherlock Holmes makes it out to be, it is still very intellectually stimulating because you get to learn all these things and apply in like a problem-solving manner, and then make decisions about how to treat a patient, which is, I think, really interesting.
Yeah, so I think medicine and dentistry have a similarity in that you'll be learning about the human body and seeing how it applies on a daily basis. You can understand the mechanisms of me raising a hand or an injury to the bone or soft tissues.
Yeah.
So it's very, very applicable.
There's one last pro. This is such a cheesy one, and you hear this a lot, and it's lifelong learning. And it might even be a con to some. So I just think that because in medicine everything's rapidly evolving and we're constantly learning new things and expanding what we know and our scientific knowledge, it means that medicine's a really dynamic and exciting field where you constantly get to improve the way you treat patients, improve patient outcomes, and overall you're just always learning, which I think is really exciting.
Yeah, so I think that applies for dentistry as well, because you're always going to be required to update your knowledge as science advances and the older knowledge becomes outdated. How we treat one disease today might be different how we treat the disease tomorrow.
Yeah, exactly.
So now we're going to jump into the cons of each degree, and these are the reasons that you need to consider and get used to because they're an inevitable part of what you're choosing. So the first con of dentistry is that you have to look into people's mouths. So some people are disgusted by that idea, and because some people don't look after their oral health as well. So that's an inevitable part of the job, I would say. If you're a vet, you need to open up animals. If you're a surgeon, you've got to open up people. If you're a mechanic, you've got to open up machines. So dentistry just involves fixing and making the oral health a better place for the patient, right? So they can be more confident in their oral health, in their smile. So we can turn something that wasn't very nice to something very nice. So that's a con, but it's something you need to consider.
Yeah. I'm probably not a good person to ask for cons of medicine because I'm very biased, and I'm really enjoying my degree so far. So honestly, I couldn't think of any cons to come up with. So what I did instead is I came up with a list of cons that I have heard or you may have heard, and I think I can speak to those and kind of discuss why I feel like they're not quite cons. So the first one is that the medicine degree itself is so long. You can hear that a lot, and especially if you're in high school trying to decide between other degrees which are like 3 or 4 years. A 6-year degree feels like a big commitment. It feels like a really long time in uni. But in the end, it's not so bad. So the reason why is because it's really only your first 2 years that you spend purely at uni doing lectures and like uni stuff. In your 3rd year, you're in hospital. In your 4th year, doing research, and 5th and 6th years in hospital again. So really, to me, it feels more like a 2-year degree and then 4 years of like practical experience and learning more clinically based stuff, which is really exciting. If it was 6 years of like straight lectures and tutorials, that would be different, and that'd probably be quite boring.
Yeah. Okay, so the next con of dentistry I have here is that it requires good manual dexterity. So if you're someone who's not great with your hands, probably medicine is a better option because there are aspects of medicine where you don't really require to be using your hands on a daily basis.
Yeah, if you're not a surgeon.
Obviously, if you want to become a surgeon, you need to be good with your hands. But if you just want to be a GP and interact with different people every day and diagnose and provide treatment options, then you're not really using your hands on a daily basis to the degree where you need to be using as a dentist. So along with that manual dexterity is getting yourself into awkward positions on a day-to-day basis where you've got to lean over the patient and you've got to make sure that you keep your posture well so that you don't develop problems with your neck and back pain later on in life. So there are many cases of dentists who don't overlook the idea of the stress that dentistry places on their own body.
Yeah.
And so that is definitely a con.
Another con you might have heard from med is that people will say that it takes you a really long time to become a doctor. So you'll do your 6 years of undergrad med and then you have to train after that before you become a fully fledged doctor. And so I agree and disagree with that. So yes, it does take you a long time to become a fully fledged doctor, but what people mean by that is a consultant. And so the consultant's the person who's ahead of the team of doctors, and he basically makes all the big decisions. He or she makes all the big decisions. So when you graduate medical school though, you're automatically a doctor. So straight away you become a doctor, and you're referred to a junior doctor. So you work with a team of other doctors and you pretty much do what doctors do. You help other doctors with managing the patients and the treatment and so on. So while there is a period of study from when you're a junior doctor to when you become a consultant, you do have to study and work for that. Honestly, I don't think it's too different to any other kind of profession where after you graduate, there are exams you have to sit. For example, like the bar exam for law or your CA for accounting. There's always like things you have to progress before you get to that top level. And so the top level in medicine is just the consultant.
Yeah. So a common misnomer is that when you're studying to become a consultant, you're also working, right?
Yes, you are working.
So it's not another 3-4 years of study after med school.
Yeah, exactly. You're working as a full-time doctor.
Yeah, so you'll be working
patients.
under a consultant in that specialty if you choose that specialty.
Yeah. So the consultant's pretty much the boss.
Yeah.
And you work for them and you see patients and stuff.
So you learn the skills from the big guy.
Yeah.
And then you become the big guy later on.
That's the goal. Yes.
So a common con I would like to speak for in pretty much all health degrees is sometimes dealing with the patient who doesn't understand your perspective. So communication is definitely important in any health degree, is that sometimes you might come across a patient who's a bit, who doesn't understand your perspective or how you see things as a professional, where they see things as a layman. Right? So sometimes these patients are a bit more trouble to deal with. Yeah.
There's one more con, which you guys might have heard, which is the working hours as a junior doctor after you graduate med school. And so you might have heard that the working hours are really bad. You work really long hours, you're tired all the time, you don't get enough sleep, and so on. So in terms of that, you might have heard all those nightmare stories from like newspaper articles. You might have even read the book This Is Going to Hurt by Adam Kay, which is like a series of diary entries of when he was a junior doctor in the NHS. And so that might be one of like the preconceived notions you have as a junior of what junior doctors would be like. So obviously I can't speak too much about it because I'm only in my 4th year of med school, and so I obviously haven't worked as a junior doctor. But from what I've heard from my friends and what they tell me about their jobs, they pretty much seem to feel like while it is a lot of hours of work, and they are worked hard, they are managing it well. And I think partly that's due to the fact that there are changing conditions, so it's quite different to what it was like as a junior doctor like 20 years ago, due to like advocacy on behalf of like medical school bodies and things like that. So I think things are getting better, and it's definitely not as terrible as like some of the horror stories you might have heard.
So now that's pretty much it for the cons of both degrees. We're going to talk about what you can expect with both degrees. Okay, some similarities.
Yeah. So one of the main similarities is there's a heavy science focus, and mainly the sciences of the human body. So you learn a lot of anatomy, biology, chemistry, physiology, pathology, and so on. And so if you have an interest in science, then I think both degrees will speak to that interest.
Yeah. So number 2 is that there are going to be long hours at university, in the clinic. So for example, in second year, for me as a dental student, we get allocated the clinic from 5 p.m. to 8 p.m. on a Wednesday night. So it's not the best time, but you just got to deal with it. So a lot of the times you'll be facing a lot of hours at university. For me, it's about 20 to 24 hours a week. Daniel, what's your hours like?
In first and second year, it's around 20 hours a week. And then in the years after that, it's quite flexible depending on like what goes on in the hospital.
Yeah, so expect to be at uni for a good portion of your week. It's unlikely that you can have a full-time, part-time job. Number 3 is communication is very important.
Yeah.
So no matter what degree you're studying, you're probably going to be interacting with people at one point. But specifically dentistry, medicine, and other allied health degrees. So do you want to talk about your experiences communicating with patients?
Well, I think, yeah, so I think being able to communicate with patients is one of the reasons I picked medicine, actually, because you get to interact with people all the time. And so it's quite similar between both medicine and dentistry, because you have to talk to patients, kind of figure out their medical history, and like any, risk factors they might have and things like that.
Yeah, and also explaining to the patient about medical terms.
Yes.
Or dental related terms, because they don't have the same education or background as you do as a health professional. So they may not understand particular terms or particular treatments and why you're choosing that particular method.
Yeah.
So being able to explain to them is very important, and is very important for that professional relationship between a doctor or dentist to a patient. Okay, so last but not least, hopefully this video has helped you guys differentiate between the two degrees. They're very similar in many ways. In fact, I think a long time ago, dental and medical students used to study and be taught together for a period of time before they separated, because a lot of the things we learn do overlap. I mean, Daniel was looking at my notes and saying, wow, I didn't know you needed to learn this.
Yeah.
So there's a lot of similarities, but at the end of the day, most likely or not, you're going to be choosing one, okay? But if you're really, really motivated and you're really, really studious and you're really, really smart, you can study both. Now, there's a specialty called the oral maxillofacial surgeon. It's a specialty of dentistry and medicine that requires both a medical and a dental degree. So for those of you who are really motivated to make an impact on people's faces and jaws, who've maybe got into like motor vehicle accidents and need rectification, that position is available, but it's just highly competitive. Okay, so thank you for watching. If you like this video, please hit the like button. Thank you for Daniel for joining me today. Hopefully we'll see him again in some future videos. Don't forget to hit the subscribe button, and we'll see you later.
Comment down below.
Alright, peace.